Welcome to the fourth webinar in the 2020 Northwest Metastatic Breast Cancer Series. I'm Molly O'Connor, Executive Director of Komen Puget Sound and your host for today's webinar, which will dive into health insurance navigation. As many of you know by now, this year we're bringing you a virtual series of talks to support you with help and hope. We are also part of the 2020 Virtual NBC Impact Series, which we kicked off back in September. Recordings of the first two webinars, Hot Topics and NBC, and Clinical Trials Access and Navigation are available for on-demand viewing, and you can find them on the homepage in Whova or on the Komen Puget Sound website. You can also view the complete list of local and national webinars on the homepage of the Whova app. I would like to thank our generous sponsors who helped make this web series possible. You can visit their virtual exhibitor booths after the Q&A for today's webinar from right within the Whova platform. I encourage you to visit their booths and learn more about their programs and the work they are doing on metastatic breast cancer. Our presenting sponsors are Seattle Cancer Care Alliance, CGen, Swedish Cancer Institute, gold sponsors Lilly Oncology and Novartis, silver sponsors AstraZeneca and Pfizer, and supporter Guardant Health. I would like to take a moment to thank some very hardworking folks who made this series happen. To the team at Komen Puget Sound, your vision and dedication are greatly appreciated, especially pivoting in this different year. Sylvia Kennedy, Christine Zakaris, Heather Neal, Scarlett Shepard, Heidi McAfee, and Tina Burns. And today's Q&A moderator, Diane Mapes of Fred Hutchinson Cancer Research Center. If you are active on Facebook, Instagram, or Twitter, please help us get the word out about the series by sharing it with your networks. You can post your own content using this hashtag NWMBC series and METSBC. You can also share a link to the webpage with information about the series, komenps.org NWMBC. It's with great pleasure that I introduce today's speaker, Callista Kennedy. Ms. Kennedy is a program manager with King County Access and Outreach. As a certified navigator and enhanced user with the Health Benefit Exchange, she assists individuals in enrolling in health insurance, giving them the opportunity to access healthcare, some for the first time. She provides assistance in completing applications, advocacy, resources, support, and navigation for clients who are experiencing barriers in accessing services that can affect the quality of their daily lives. As the program manager for the King County Navigator Network, she assists in maintaining this network for King County, ensuring compliance with Navigator access, providing training and assistance to other navigators with application issues. She also facilitates community partner trainings and maintains positive and strong relationships at community outreach locations. Please submit your questions through the Q&A panel in the Whova platform. You can also vote on questions you're interested in using by doing a thumbs up. We want everyone to get the most out of our limited time for questions and answers today. This means general questions without details about a specific situation are best. Please keep in mind that Ms. Kennedy will not provide specific advice during this question and answer period. Please join me in welcoming Callista Kennedy to the screen.
Good morning, everyone. My name is Callista Kennedy. I'm with King County Public Health, Seattle and King County Public Health Access and Outreach team. And I am going to present to you your health insurance options through Washington State. And I hope that if you have any questions, feel free to post them and we will get to the questions after the presentation. So thank you all for being here today. Okay, so as I said, I'm with King County Public Health's Access and Outreach team. We are the lead organization for King County, working with community and partner agencies to help reduce uninsured rates in King County. This year, we have also taken on Clallam and Jefferson counties as well to help people get through the insurance open enrollment period. Our staff are all certified navigators through the Washington Health Benefit Exchange. We provide enrollment assistance and education to individuals applying through the Washington Health Plan Finder. And you see the Health Plan Finder website there on the bottom, just to call attention to it. It is Health Plan Finder, all one word, and .org. Recently, there's been a lookalike site, which has been taken down, we think, by the state attorney general. So just make sure you're going to the wahealthplanfinder.org, all one word, if looking on your own. As I said, we are the lead for King County. We have also taken on Clallam and Jefferson for this open enrollment period. And on the screen here, you'll see the other 9 lead organizations throughout the state, which all have certified navigators. The stars that you see on the screen are where the exchange enrollment centers are, which are a combination of both healthcare navigators and brokers in most locations to assist you in getting your health insurance options through the health exchange. And again, this is just the differences between the two. Navigators are, again, statewide. They provide enrollment assistance, support, updating applications, and we do that year round. Certified brokers, they can do a little bit of what we call the deeper dive, where they can get into the actual what's best for you. This product works best for you, as in a recommendation, where navigators provide an overview and can explain the breakdown of your cost. And that the brokers are allowed to make recommendations, and that's essentially the difference between a navigator and broker. There are 11 of those enrollment centers throughout the state. Like I said, most of them have brokers and navigators co-located. And again, the website is called out for you there, which is wahealthplanfinder.org. Okay. All right, so what types of insurance are available in Washington state? So this is a breakdown when we talk about state-based product insurance of what's available for you. So there's the Washington Apple Health. This is the state's Medicaid program. Most of these programs are free, and there's no co-payments, co-insurance, or annual deductibles. These program eligibility is determined by income. So this is what we see with Washington Apple Health, the adult program, which is for individuals 19 to 64, which was brought on with the Affordable Care Act. People sometimes call it Medicaid expansion still. Our children's program, which is actually pretty robust in Washington state and covers children through their 18th year. And that's the program where you may see a small premium when you get up to the higher income limits, because this covers children up to a healthy federal poverty line standard of 317% of the poverty line. And we'll touch on that a little more later. We also have the pregnancy medical programs and our early emergency medical programs. And if clients are over income for these programs, they can usually enroll in a qualified health plan if they have no other employer-based or other options for insurance. Those are called our qualified health plans. Those are those exchange-based plans. These are certified by the state health commissioner. They meet the coverage requirements set forth in the Affordable Care Act. And there is no pre-existing limitations to these programs. These do have monthly premiums, co-payments, and co-insurance, and annual deductibles. And tax credit assistance through the IRS is available in most cases to help clients reduce their monthly premium costs. In Washington state, those who enroll through the exchange, about 76% receive some form of tax credit assistance to bring down their premium. And then for our individuals who are age, blind, or disabled, there are what's considered the classic Medicaid programs. These are the programs that existed before the Affordable Care Act. It's based on disability defined by the Social Security Administration. And so not only do they have to meet the either aged, blind, or disabled requirement, they would also have to meet income and resource limitations for this program. These programs are long-standing and do not have high income limits, and you enroll through DSHS still. But that is still an option in Washington State. It's those classic Medicaid programs. To break this down a little further, as I said before, the Apple Health for Adults, 19 through 64, some additional requirements you see there on the screen. In addition to income, you cannot be eligible for Medicare and receive this program. You cannot be incarcerated, and you do have to meet a citizenship and or residence requirement as defined by the federal government in order to be on this program, meaning if you are a non-citizen, you have to have been in the United States with legal documentation such as a green card for 5 years or longer in order to qualify for this program, unless you are a refugee or asylee. And you must intend to reside in Washington State. Again, we applied for this program through the Health Plan Finder. Same thing with pregnancy and children's medical. We apply through the Health Plan Finder. All these programs have that Washington State, you must intend to reside here qualification. Income requirements for our pregnancy and children's programs, though, immigration status is not a factor. And you can see some of the additional requirements for those two programs on the screen. It's one thing to note, if someone qualifies for the Apple Health standard income-wise, so if you're 19 to 64, you qualify income-wise, and you are offered employer-sponsored insurance, maybe it's free to you, you can actually accept that insurance and still have the Washington Apple Health Medicaid to help meet your out-of-pocket cost. It would be the payer as last resort, so otherwise known as secondary. So your primary insurance would pay first, and if you had like a $20 copay, then Apple Health would pick that up. But for example, the Washington Apple Health for Adults, the current income limit, everything is based on the poverty line, is the current limit is 138% of the federal poverty line, which for a single adult is $1,468 gross per month. And so that's for the adults. Children in pregnancy is higher, but for the adults, the income limit is still set at that 138%, which was established federally with the Affordable Care Act. What does Apple Health cover? Most clients approved for Apple Health have a managed care plan. The exception to that is our Native American or Alaska Native population. They can opt out of the Healthy Options managed care program. We have 5 here in Washington State, and you can change plans from month to month if you choose to do so until you find the one that works best for you. They cover a high level of care. You can see there on the screen. They cover major medical. They do have differences like, of course, provider networks and prescription formularies vary from plan to plan. They also offer certain extras they call enhanced benefits or value-added benefits to kind of get you to choose one over the other. For example, on this list, AmeriGroup and Community Health Plan under Vision, you see it says only exams for adults. Those two actually give their members a $100 per year allowance to put toward a pair of frames for actual help with paying for the hardware. So they do those little incentives to help entice you to pick one over the other, because most of the medical coverage between these 5 plans is pretty much exactly the same. So we're going to move on to the qualified health plans. As stated a couple times, if you're over income for Apple Health, in most cases you can enroll in a qualified health plan through the Health Plan Finder. Most of the time, there is an open enrollment period for this. This year for 2020, it will be November 1st through January 15th of 2021. We're extending open enrollment this year due to the introduction of Cascade Care, which we'll cover toward the end of the presentation. But during open enrollment, anyone can enroll. You can look for the tax credit assistance. You must file taxes in order to get that tax credit assistance, but it can help you reduce your cost of your monthly premiums. And depending on your income level, it may also give you some reductions in your cost sharing amounts, such as your co-pays and co-insurances. Deductibles may all be reduced depending on your income level. That's during an open enrollment. However, during the year, if you have a qualifying life event, such as losing a job, getting married or divorced, moving from one area to another, either in Washington state where it causes you to lose your coverage, or from another state and it causes you to lose your coverage, you may be eligible to enroll at different parts of the year. But most people are going to enroll during the open enrollment period. So this is just an overview of the tax credit system. It helps you reduce your overall monthly premium. That's the tax credit amount. And it's based on income. So basically, this is a system where, as in any insurance, the older you are, the more it costs to cover you. So depending on your income, the higher your tax credit will be. So for example, if someone 22 and someone 62 had the same amount of income, the person that is 62 would see a higher tax credit amount because their overall insurance is more expensive. So it looks at the affordability, what you can afford at your income limit versus the price that your actual insurance is to calculate that tax credit. Now that is a simplification. There's some other things that calculate into that, but that's basically how it works. If you are less than 250% of the poverty level, if you choose a silver plan, there are reductions not only to the premium, but also to those deductibles, co-pays, and co-insurance amounts. If you are a Native American or Alaska Native and your income is under 300% of the poverty level, you would have no cost sharing amount. So you would only pay the premium. So if you're under that 300%, it would determine how much of a tax credit you're eligible to receive. And you can apply that to any plan, gold, silver, or bronze, because you wouldn't have to worry about those co-pays and deductibles when you go to the doctor. And then down below on the screen is just a good definition of what each of those out-of-pocket expenses really are: co-payments, co-insurances, and deductibles, as well as your out-of-pocket, which is the limit where if you spend that in a year, your insurance then would have to pay the rest at 100%. All plans cover the basics. Again, no pre-existing conditions, but they all cover doctors and hospitals, maternity, prescription drugs, preventative screenings, vaccines, chronic disease management, mental health, and COVID-19 testing and screening. By mandate, not only is it to be covered in Washington state, it is to be covered at no out-of-pocket costs for any of those COVID-19 testing or screening services. So now we're going to go into the actual 2021 qualified health plans and take a look at what's offered to you through the exchange. So what we're seeing this year for 2021, we have some major themes that we're seeing across the board from our plans. In Washington state, the prices are lower this year in most counties. There's a couple exceptions where it's coming out a little higher or the same, but in most counties, the prices have gone down a little bit. We have more carriers and therefore more plan options. And with the introduction of Cascade Care, we have what's called standard plans and public option offerings available for the first time through our Washington Benefit Exchange. So if we look at what's coming up for next year, as far in terms of what we have now, so the average rate of decrease from 2020 to 2021 is about 2.4%. Like I said, it's gone down a little bit, which is still a good sign. We would like to see those prices get better, but it has gone down a little bit. And about 95% of consumers, existing consumers on the exchange, will experience a premium decrease or just a slight increase, which is about a fluctuation of about 1% in either direction. The reason some folks would see a decrease is because, again, when the overall cost of insurance goes down, that makes it more affordable. Therefore, your tax credit may see a decrease if you're getting a tax credit. So there may be some instances where someone was getting a low tax credit because they were pretty close to the income threshold, and now the price of that insurance that they bought last year actually went down. So they would see their tax credit go down, which would create a little bit of an increase for them. But for the most part, most folks are going to see that decrease. What we have on our market this year is we have 13 carriers, up from 10 last year. So we have the 3 new coming on: Community Health Network, Regents, and United Healthcare are both returning after almost a 6-year hiatus from the exchange. They've been gone, and those 2 are coming back this year. All counties have at least 2 carrier options, whereas last year we had 8 counties that only had 1 insurance carrier option. There is a total of 115 different qualified health plans available. And what that means is this: carriers offer options in metal levels, gold, silver, and bronze. So one carrier may offer a total of 6 bronze plans or 12 silver plans, and that's where they get the 115 total qualified health plans that are available. In the largest counties, King, Pierce, and Thurston, consumers will have anywhere from 69 to 73 plan options. Plan options can also vary a little bit by age. For example, those under the age of 30 get offered a catastrophic option. So for someone 30, you might see, 60, 69 or 71 options because they're throwing in those catastrophic options, where someone who's 50 doesn't get that catastrophic, so they might sit right at 69. So that's where you see differences like that as well. So this depends on where you're applying and which plans you're offering. But we see in our largest counties, we're in the 70s as far as plan options. In 2020, we had 43 statewide where a particular qualified health plan choice was offered all over the states. Most offered in a county were 35. So you see those differences from last year to this year. We're almost double of what we were offering last year. And then, of course, our new standard plans under Cascade Care, they're available to all counties. And then we have 5 carriers offering that new public option plan. And from those 5 carriers, they're going to be offering those plans in 19 counties. And I'll give you some more details about those standard and public options plans here in a few minutes. These are our carriers. You see them here. And then our 2 dental carriers. Like I said, we have new Community Health Network, Regents, and United Healthcare, and then the ones returning from last year, Kaiser, LifeWise, Molina. So we are building a strong network of carriers here in Washington State. So I've mentioned this a couple times, and so I'm giving you this graphic to show you what I mean. Our plans on our marketplace are tiered: gold, silver, and bronze. And here's what that means. The bronze has the lowest premiums, but the highest deductibles. Our silver plans are in the middle, more of a balance between premium and deductible, but they generally offer the best value. And if you're low enough income, you get the cost sharing reductions if you choose a silver level plan. And then, of course, gold has the highest monthly premiums, but the lowest deductibles. And then there on the right is a little graphic that just shows you how they calculate that tax credit assistance, where they take your premium, the amount of tax credits you're given based upon affordability, and that's how it lowers your monthly payment to your insurance carrier. So whenever you go into the qualified health plans and see this gold, silver, bronze, this is what we call our existing structure. for non-standard plans. But this is also still the structure on our Cascade Care plans as well, gold, silver, bronze. However, where we see the difference in the standard plans, which I'll show you in a second, is that there are more services before the deductible is applied. So let's move to that. So I can show you a little more clearly how Cascade Care works and how it affects that gold, silver, bronze structure. So basically, here are the legislative requirements. When they created Cascade Care, here's what they said. In Washington State, we're going to offer a public option. What that means is that the State Health Care Authority and the Benefit Exchange are contracting with these insurance carriers to offer state procured plans under a public option. And basically what that means is these plans have a reimbursement cap that's tied to the Medicare reimbursement rate. And they have to meet quality and value standards to be offered and cover the patients. Now, most of that is on the back end, as far as dealing with reimbursement and caps and things of that nature. What it means to you as someone who is buying insurance is that if you have a plan where it's offered through the public options, you should see a decrease in your monthly premium because of these reimbursement caps and quality standards that are set forth in the state legislative requirement. So basically what you're looking for is this plan, when you look at it, may offer you a better premium value when you're choosing a public option Cascade Care plan. Then there are the standard plans. So what these standard plans are is they're a set of payment options, basically that says for product X, service Y, you will pay this dollar amount. And I'll show you a slide that better explains that here in a second. But basically what it is, it sets a standard where no matter which carrier offers these standard plans, they have to offer the plans in exactly the same way. And the co-pays, any deductible amounts, all have to be standard across the board. So if it's a silver level plan and it has a $30 copay for the doctor's visits, every single carrier that offers a standard plan is going to have a $30 copayment for a primary care doctor for that particular plan. So they are allowed to choose different premiums for that same product, but the client or the person who selects this plan and purchases this plan, their out-of-pocket will be the same amount. And then they're doing a subsidy study based upon who buys the plans and how they're issued by both the HCA, the Health Benefit Exchange, and HCA's Healthcare Authority. I apologize for using acronym over and over again. And then the Office of the Insurance Commissioner. They're developing a study to figure out a way to offer premium assistance to individuals up to 500% of the federal poverty level. So the current standard is 400% set by the ACA. They want to go up to 500% in Washington State. So they're looking at the plans and how they're purchased to see if they can come up with a method for issuing an additional subsidy to individuals who purchase through the exchange in Washington State. So basically, when you see these plans on the exchange, if you're shopping, the standard plans will say Cascade, and then the public options plans will say Cascade Select, and that's how you'll tell the difference between these two. And currently, these plans will only be sold on the exchange. So another basic overview of how this works. So the standard plans are required of all the carriers. So all 13 carriers in every single one of the 39 counties in Washington State have standard plans. The public option is voluntary. We currently have 5 carriers offering these, and they're in 19 of the 19 of the 39 counties in Washington State. Most carriers are offering non-standard plans along with their standard plans. So basically the plans they had last year. They are offering that kind of traditional ACA structure along with the new standard plans. And then some people who already have coverage through the exchange are being auto-renewed, but they will not be auto-renewed into a Cascade care plan. So we are encouraging people, if you were on last year, to at least go in and look at the Cascade care plans, because you may get more value out of that plan. And we are doing, of course, outreach to consumers on how these new plan choices are offered and what's available to you. So this is the standard Cascade plan structure. And like I said, when you look at these on the exchange, they will say Cascade, and they're all offering them at all levels. There's a total of 51 of these. And so anywhere from 6 to 27 of these plans are available in each county. About 13 is the average, but they are available in every county. So I hope that you guys can see this chart. If you can't, these will be available longer for you to look. But what you see here is, if you look at a plan, if we take silver, it has a $2,000 deductible with a maximum of a $7,800 out of pocket. And then when you look at the services down the list, what you see is dollar amounts. So instead of having percentages like 20% for the emergency room, you under a silver plan would have an $800 copay or a $450 copay in gold. The ones you see shaded in blue, all of these services shaded are not subject to the deductible. So again, if we look at this silver plan here, urgent care is a $60 copay. Primary care visits is a $25 copay. Specialist $60, $25 for mental health. And we could go down the list. Let me see. Prescriptions, generics, $20 copay. Preferred brands, $70 copays. So all of these are copay services versus a percentage. Now there are some that are still percentages. But for the most part, your major medical services are coming out as copays rather than coinsurance. So it makes it easier to determine how much you're going to be spending and when. If you look at the shaded area, there are quite a few ongoing services as far as compared to the qualified health plans that we've had for the last 7 years under the exchange. One of the biggest things is labs and x-rays having a deductible. You see in this structure, labs and x-rays are not subject to a deductible. So it's just a structure that makes the charges more clear, and in certain instances can reduce your overall out-of-pocket costs because you are not having to meet that deductible before you get services. So you are seeing actual value out of your insurance coverage because they are paying from the beginning when you start paying the premium for most of your regular costs, as far as your regular doctor's visits or your regular specialty visits. They are paying before any deductible has to be reached. So this is the structure that will hopefully give people more value and a clear understanding of how their insurance works. All right. And so I just went through most of this. The value of the standard plans is access to service before deductible. Most copays are provided for clarity and predictability of costs. Even on bronze plans that have a high deductible, you will see services before that deductible. And then it maximizes your tax credits by having more services paid up front. The Cascade public option, the structure in and of itself is exactly the same as the standard plans. The difference is how the carriers are reimbursed, and that leads to lower premiums. So you might see the same exact structure, but your monthly premium should be lower based upon how the reimbursement structure is, and that's what you will see. So this is just another slide to show some of the differences. If you look at the standard plan, what we have in 2020 for our current median rates, what we have in 2021 for the non-standard plan range. So that just shows you about deductible decreases, first dollar services without meeting deductible, and how, that the standard plan is now the lowest cost silver plan in 8 of our counties. And this is a good slide because it shows you, this is a standard for someone who is managing diabetes. So if you look at the non-standard plan versus the standard plan, the non-standard plan is about 40, not quite $40 more expensive than the standard plan, but you see the deductibles lower. Primary care visits is about the same, but lab services, your emergency kits, things like that are all lower under our standard plan options. And then open enrollment is November 1st through January 15th. And if you enroll before December 15th, then coverage would begin January 1. If you enroll between December 16th and January 15th, your coverage would begin February 1st of 2021. And I've also included our navigators on the end of this presentation, both our outreach-based navigators here, and then our navigators at our public health clinics. You are welcome to reach out to any of us. I'm going to go back one here real quick. You are welcome to reach out to any of us to get assistance. Our numbers are all there. Our 2 walk-in locations at Federal Way and Metro are here at the end. And also our community health access line. This is a phone number that our navigators staff every day. We will have some instances where we have extended hours. If you go to the web link at the top of this screen, we also have a online request form where you can request a meeting with a navigator either by phone or virtually. We do have some walk-in locations if you really want to meet one of us face-to-face. We're happy to do that. We have some walk-in locations still with social distancing protocols in place where you can actually meet someone one-on-one, and we're happy to help you anytime. It was wonderful to present to you today, and I look forward to seeing all your questions. Thank you.
Hello, folks. This is Diane Mapes. Some of you may know me as Double Whammy. Callista, thank you so much for that great presentation on health insurance in Washington State. I know that that is a topic that it's important to many, many, many of us. And we have a lot of questions that we're getting in already for this. One that is just come up. Callista, can you hear me okay?
Yes, I can hear you.
Great. With premiums and co-insurance, I pay out of pocket $9,000 per year, plus supplements and co-insurance for my kids. It's well over $11,000 a year. As a stage 4 cancer patient, there's no end in sight. How can I help cover those costs? AFLAC?
Okay. So there would, with the how the programs work in Washington State, I apologize, try to phrase this so it's not so wordy. With the structure of the insurance in Washington State, I would first need to ask, what's your source for the insurance? Is it employer-based, where this is a plan that is tied to getting it from your job, which with the out-of-pocket costs that you're showing here, I would think that it would probably be something employer-based, or maybe potentially something you bought off market, because currently none of the exchange products have a $9,000 out of pocket per year. There are some, depending on what kind of supplements you're buying, there are some services like GoodRx and things like that that may help you with that portion. But as far as your general overall out of pocket, if this is an employer-based insurance, there's very little on that side that you can do to reduce that, because that's what your employer has chosen to purchase. If you stay on that. As far as your children's coverage goes, depending on your income level, we could potentially look to see if the kids were potentially eligible for Apple Health, because that would reduce that out-of-pocket cost, where you could have the kids on Apple and you stay on the other insurance. You may want to do a comparison to something on the exchange, where if you are with an employer-based insurance and you have a large out-of-pocket like that, if you went to the exchange and searched for the carriers, you wouldn't be eligible for the premium tax credit assistance since you're offered employer insurance, if that's the case where this is coming from. But you could do a comparison with the out-of-pocket and see if, when you look at just premium, it's probably going to be cheaper if you're on an employer sponsored. But if you look at the overall costs, not just the premiums, copays, and out of pocket, is there something, that is more affordable through that exchange-based method versus where you're getting your insurance now, to see if there is an option that would provide some relief with those total out of pockets, because that is a pretty high out of pocket. So just to kind of sum up, I would first take a look at where you're obtaining this insurance, and then if we could do a comparison and see if there were cheaper options for you, and then also whether or not the kids may be potentially eligible for Apple Health, because the kids program does have a substantially higher income limit than the adult program would. As far as AFLAC, what I know about that is it needs to be connected through an employer. So that if this is not an employer-based insurance, or if your employer hasn't signed up for that, I don't believe that they've changed any where they would be any self sign-up options through that particular program.
Thank you very much, Callista. I cover financial toxicity a lot at Fred Hutch, where I work as a writer, and I'm sure that you're familiar with that term. $9,000 out-of-pocket payment is not that much for a cancer patient, particularly someone with metastatic cancer. It's a huge, it's just amazing how these medications have skyrocketed, the costs of them. So it's very important that people have options. You mentioned one resource, RX meds, was it you said?
So there's those supplemental programs. Good RX is one of them. The other one is called Single Care. There's also the Washington Prescription Assistance program that is still available. And then what's the other one called? The Navia. Navia is another one. Navia, yeah. And they can offer anywhere from usually a range of about 25%, even as high as 60% reductions on certain medications. And they can be used in instances where maybe a prescription is just not covered. And sometimes the discounts on certain meds would actually be cheaper in lieu of using your own insurance. So it's a good option to search for affordability. You can sign up for multiple ones at the same time. There's even a website, Partnership for Prescription Assistance, PPARX.com, that will actually help you search and compare them. You just put a profile of what your medications are. So like, it's kind of a good thing to have in your back pocket. Certain over-the-counter supplements that aren't covered, they give you discounts on. So it's good to search those to see if it can help you reduce some of your extraneous costs when you're talking about.
When you're dealing with cancer, the cost
Yeah.
could be $9,000 out of pocket a month.
Yeah.
Per year, a
Yeah.
month.
Yeah.
Yeah. So I just would like to point out that I know that there is a list of resources for patients, financial resources, that was put together by ASCO, the American Society of Clinical Oncology, and it's available on cancer.net, and we put it into a document form, and that's going to be located within the Whova app. I also I noticed that you put together, Callista, a really great little recommendation form when it was for people who were managing diabetes plan.
Mhm.
I was wondering, is that the plan that you would recommend maybe for cancer patients? Because they're going to have ongoing costs as they manage it.
Yeah, so that was actually an example put together by the State Benefit Exchange. And the thing about that, there are specific chronic ongoing services that the exchange utilizes as examples when you're searching and comparing plans. Managing diabetes is one, having a baby, and I think the one they added this year was like a fractured leg or something like this. So these are standard examples of where when you're having chronic disease management, how to do the direct comparison. The Health Benefit Exchange website, when you go into the Health Plan Finder and you search for a plan, they have a tool embedded in there called Smart Plan Finder, where you can put that information in there. What's your chronic illness? You can search for your providers, your medications, how many times a year you go to a doctor, and it will go through the plans and do a search and show you recommendations that will be your best cost options, and also whether or not the providers are in network. So the system does have a tool to help you break that down. That specific example, like I said, was provided to me by the Health Benefit Exchange. So they didn't attach a specific carrier to that. So I don't know which actual carrier is offering that specific option. I would have to search the system to find it. But it can be more specific to your own condition, your own medications, by utilizing the Smart Plan Finder tool when you search for a plan, when you have applied through the exchange.
That sounds like a really useful tool, Callista. Thank you very much. We've got another question about a specific medication that's for a very specific breast cancer mutation. Actually, the medication may appear in more than just breast cancer. My insurance provider, Regents Uniform, has denied my appeal for Piqray. That's the medication. I still have 2 levels of appeals left, but I'm curious which plans cover Piqray and what the criteria is for coverage. Piqray is a medication that's used for the PIK3CA mutation that's pretty common in ER-positive breast cancer, both ductal and in lobular. So this is a new medication out on the market. It's probably very expensive. What can she do to get that coverage?
So that's because that's pretty specific. We would need to do what we would need to do is a browse utilizing that tool and put in that medication and see if it was listed. If it were not to be listed on any of them, then what we would do, how we work something like that out on our end, is we would then reach out to our carriers and say, hey, when we put in this medication, because sometimes new stuff takes a while to load, even if it is covered. But what we would say is, hey, this is a new medication. Are you covering it? And what pre-authorization is required? So we actually build those relationships with the carriers so that we have representatives we can go to and ask these types of questions and get those types of answers for the person that is looking to enroll through the exchange.
I think having an advocate who can represent you is really important. I know a lot of the big cancer centers will have financial navigators that can help patients apply for assistance or charity care, or help them deal with insurance issues. Here's a big question that I'm sure comes up a lot. If an insurance claim is denied, who can help file the appeal? What's that process, Callista?
It can differ a little bit from carrier to carrier. They all do have an appeals department. We've had a ton of advocates. We have navigators or certified application counselors at all the hospitals in King County that do assist individuals with filing appeals if they're having difficulty filing it on their own. We here at King County have helped people walk through the appeals process and find it on their own. So pretty much any of our certified navigators, there's almost 300 in King County at various hospitals, community-based clinics that are willing to step up and help clients if they need assistance in getting through to their carrier or filing an appeal.
I think that we have maybe just time for one more question. This is an important one, Callista, and I know that this is on a lot of people's minds right now. What are the options in Washington for Washington state residents who are dependent on the ACA? What are the options if it's overturned? Is coverage going to continue to the rest of the year if you already have enrolled for 2020? What protections do residents of Washington state have with regard to pre-existing conditions, lifetime limits, and requirements for insurance coverage?
Yeah. Actually, this question has come up frequently over the last several months because of what's going on in the courts. If the ACA would be overturned, Washington state actually has taken steps in our state legislation to protect the plans that are offered through our state-based benefit exchange. Since we do not use healthcare.gov and we've developed our own exchange, and when we certify our own carriers, the state has taken steps to protect the benefits offered through the exchange. One effect we may see, which would be somewhat detrimental, is there may be an effect to the tax credit assistance that lowers the premium cost if the ACA is completely overturned. And that's why they're doing things like the premium study along with Cascade Care to see what the state can do about continuing those options. But as far as the plans, the coverage would not just be discontinued through our state exchange. Our state legislature has built in protections for our own exchange to continue should an overturn happen within the court system on the federal level.
That is really good to know, Callista. Thank you. That's very important news for Washington state residents. Here's another question from a metastatic breast cancer patient. Can you talk about the issues of the federal waiting period for SSI Medicare? And are there any state programs that can support patients during those waiting periods, especially metastatic patients who need to quit work after their diagnosis? Who's going to fill in that gap?
Yeah. So when you're in the period, your 24-month waiting period from your Social Security for the Medicare, you can, depending on income level, if you are under 65, which most people at that point are, if you're under 65 and you're in that 24 months, you can, depending on income, enroll in any of the health options through the exchange. So if you're Apple Health eligible, you could continue to receive Apple Health. If you are on a qualified health plan, you could continue or enroll if you needed to enroll due to loss of other health insurance due to having to stop work. You could enroll through an exchange-based qualified health plan as well during that waiting period time. Additionally, there is the classic Medicaid program that you can enroll in. If there's any income, you may get what's called a spin down, where you would have to incur costs before the Medicaid would kick in, but there is still those options while you're in your waiting period. You would still qualify if you meet the income standards for any of the plans that we've talked about today.
So here's one more that's a little bit COVID related. I'm in the middle of a breast cancer treatment for stage 4. Due to COVID, my husband's lost his job and his insurance, and this person is on that insurance. What should she do? What are my options if I'm not a low-income patient?
So that's one of our toughest challenges. We encourage anyone who has lost insurance at this point to at least do the application through the health benefit exchange to see what options there are through the exchange, to see if we can find something that's an affordable fit for you, because we know it's tough when you lose, even when you lose one income when you're a 2-income household, but you're still not eligible for programs. It's one of the biggest things. So there's that. There are some agencies out there, depending on your diagnosis and situation, that may be eligible to have like an extra charity care application put in that would cover or reduce some of the costs, because there are some charity care programs through some of the hospitals that can assist with costs I know off the top of my head, because I've helped with this one a lot, like Swedish, they have assistance programs where it may not wipe out the financial responsibility, but it could reduce a financial responsibility for households up to 400% of the poverty level, even if they're not eligible for an actual insurance. So some of the healthcare systems out there do have other financial programs available. Sometimes SCCA has some financial assistance available. So we encourage them to still apply through the exchange, but there are times when we have had to explore other options, either through facilities or other programs that may help with some of the financial responsibilities that they are still incurring for care if they lose insurance.
Thank you so much, Callista. This has been really great information. Thank you so much for Common Puget Sound and for continuing on with this Northwest Mets series. This is its 5th year. Thank you.
I was happy to be asked, and if anyone has any questions, my contact information is available through the presentations. Please feel free to email me or call me. I'm happy to assist.
Thanks so much, Callista. Navigating health insurance can be confusing under the best of circumstances, and of course can be extra daunting for someone also managing metastatic breast cancer. So we appreciate you sharing this information with the NBC community and their caregivers. Just a couple of items for folks before I turn you loose to visit the exhibitor booths and community boards. First, the final webinar in the Komen Virtual NBC Impact Series is November 10th. That's a Tuesday, as opposed to the Wednesdays that we've been doing for our webinars. You can sign up for this webinar by visiting this link, KomenPugetSound.org/REGMBC. Our final topic is NBC Voices, and this is a patient-led conversation. Stephanie and Katrina, 2 Mets patients, will share their stories, and then be followed by Molly Guthrie, who is the director of Komen National's Public Policy and Advocacy team. And she'll talk about how NBC patients can engage in advocacy at the state and national level. I think this is going to be a great conversation. Next, I would like to thank our amazing sponsors one more time. Our presenting sponsors: Seattle Cancer Care Alliance, CGen, Swedish Cancer Institute, gold sponsors Lilly Oncology and Novartis, silver sponsors AstraZeneca and Pfizer, and supporter Guardant Health. I would also like to thank our speaker, Callista Kennedy, one more time, our Q&A moderator, Diane Mapes, and all of you. Thank you for showing up for this series. We designed this for you, and I hope you feel like it has been a good use of your time and you've received some good information that will help you along the way. Finally, shortly after the end of today's webinar, you'll receive an email with a link to an evaluation. We would appreciate your feedback on today's webinar and the series as a whole. And we encourage you to visit the virtual exhibitor booths and see what event sponsors have to share with you. You can also visit the community boards, which are a place where you can engage in discussion with fellow attendees on a variety of metastatic breast cancer related topics. You can even create a topic of your own. These boards are available 24/7 and we encourage your continued engagement through these boards. So that concludes today's program. Again, on behalf of Come Puget Sound, thanks for spending some of your day with us. We're looking forward to having you with us in the next webinar. Stay safe, stay connected, and have a great day. Thanks.